Good morning. My name is William Malyk. I work at the Computer Systems Group here at University of Waterloo. I'm a master's student in computer science. I'm also a part of the work group, the Workflow Research Knowledge Group. Today I'll be presenting improved workflow mining for healthcare. This is an extension of the research work that I do into workflow representations and workflow systems, and it's also my class presentation for Health Informatics. First of all, what is a workflow? A workflow is really the systematic grouping of tasks. It's concerned with how tasks are structured, how tasks are constrained, what resources are required to run a task, who is actually responsible for running that task in an organization, the firing of the task, which is what type of branching it does, what sort of loops exist within a process, and all of these things go together to carry out some type of process in whatever domain we're researching. So in this case, we're looking at workflows in the healthcare domain. Now that you know what a workflow is, I can tell you what the problem is with workflows in healthcare. In healthcare, workflows are sort of unique. You have this problem that instead of a workflow being based around rules, which happen all the time, instead of it being like what you find in the financial institutions where you find an insurance policy is the same for you as it is for me, the process which is got by in order to get that. Well, in a hospital, you go to the hospital and doctors are run by guidelines. It's pretty broad, and what they end up doing is a lot of the time they don't actually constrain themselves. They do this non-compliance thing where they say, I know better than what's actually written on this workflow. I know that these patients are very different, and so you have these things at play. You have doctors who don't want to follow these things. They don't want to be told what to do because they have the benefit of experience. And in some cases, they shouldn't actually be told what to do. And you also have this competing thing that the human body is such a random event that you can't really determine a workflow precisely ahead of time. So what you find is a result, workflow often exists after the fact. This is the way it's been described to me and the way I've come to think about it, that really what you're finding is the history of what took place in a hospital is really where the value is. So going backwards and constructing the process by which you came to those results is really where all of the magic is in workflows in healthcare. Now the problem, though, is that workflow mining, as it's called, this technique of going backwards, actually has limitations. You can imagine workflows of all sorts. You can imagine all of these representations of what you want to do, and you're only constrained when you're building a workflow by your imagination. But when it comes to a computer going backwards, a computer looking at the tasks and trying to construct a workflow, there are certain limitations which I'll touch upon, and then I'll try to tell you about how you can get by them. Now, the relevant computer science stuff that you have to know about are representations which are used in workflow systems currently. People tend to use Petri nets. Petri nets being directed graphs with two types of nodes. You can see them there on the bottom. You have these circular nodes, which simply represent places in a workflow, and you have these boxes, which represent transitions. In these type of representations, you have tokens, which, if they exist within a node, if all of the nodes leading into one of the transitions have a token, that token will cause the transition to fire. The fire will move tokens to all of the outgoing edges, and this is the way in which representations are usually done. Why is workflow represented this way? It's because it's visual by nature. As we could see, we could see the cycles present in those graphs we just saw. It's also mathematically precise, and it's subject to many forms of analysis, so it's been well used already. Currently, people are using colored Petri nets to represent extra relations, things of that nature. And a lot of times, Petri nets in the workflow area are referred to simply as workflow nets, since they're constrained in some ways. Workflow patterns now, these are what I was talking about when I said about spawning of tasks, tasks which follow others, loops within tasks. All of these things are called workflow patterns. There's been a systematic development where people have gone by and categorized all of the different patterns by things like synchronizations, repetition, things of those nature. So workflow patterns tend to be a benchmark that people will analyze their tool. So if they built a workflow tool, how easily can they represent all of these patterns? And what we see here is just a representation. It's a really crude one, but what we're seeing here is what I like to refer to as the crossover loop, which is simply that you have a task A followed by a task C and a task D. You may have a loop here, or you may have a system that comes through and loops at a different point. So these are sort of an arbitrary looping pattern. And this is going to be an example I will carry through during this presentation, so it might be worth your while to kind of memorize it at this point. Now, people apply workflow in many different areas. They can be anything from decision support to, as we see here, systems built around workflow itself. Patient workflow management systems, to be exact. Patient management systems are simply, they're driven by the idea that patient outcome isn't determined simply by the physician's skill. It's also determined by the organization which supports that physician, so the collaboration behind them. Those two things go together to get you a good result. It doesn't make any sense to go into an emergency room with the best doctors if you'll never get seen. So these are the sort of situations where you'll apply this kind of management system. They require two things: a guideline, which is, as we said before, simply the best practices approach to how something should be carried out, and an ontology of the organization so that you know how to customize those particular workflows for the environment you're in. And the maximizing of the outcome, the patient's health, is determined by putting these two things together. So these are the systems that we're going to be talking about. As I said before, you have guidelines, best practices. Typically, they're entered into the computer by some kind of operator. That operator will use some type of workflow language, visual technique. I'll show you one in a minute. The representation model is then a Petri net, so that is transformed into the Petri net representation, which we saw earlier. And the process of specifying a workflow, though, is no trivial task. I'll touch on this soon. Now, people have actually implemented these systems. They're not in theory-based or anything like that. Taking one of the older systems from '97, which is a good model for pretty much every system I was able to find, they simply have three types of steps. They have an editing tool, whereby you're entering that guideline, as I said before. They have a transition tool, which takes that guideline, builds your Petri net, and they have the low-level type builder, which would be to put that ontology on top of your guideline, which you can imagine as a template, specify it for the place which you're working, and this provides a separation of concerns. To see the actual tool, this is a picture of the editing tool which they use in their system. As you can see the visual representation there. You can also see up in the top corner where they'll represent some kind of workflow language specific to the system which they're working in. So that will put things on top of, it'll put constraints on the firing of a task, say, things like that. And then from there, you'll get the translation into your Petri net. And from there, you'll get the ontology put on top. So this is the specifying of a specific workflow rather than your template or your guideline. Now, the problem, as I said, it's no easy task to specify a workflow. These people who have to put it into the system, as we saw there, have to understand the tool itself. They have to understand the domain in which they're working. They might have to learn a new workflow language. There are many, the newest one called yet another workflow language. All of these things go into really creating sort of a confusion for the person entering these things, and a lot of times they get them wrong, especially in cases where, like healthcare, where we're saying that people don't really follow the guidelines necessarily. So what you have is this, this problem, really, with specification of workflow. And it's been suggested by Alst that workflow mining is the solution, as we said, to go from workflow logs, so descriptions of the task after the fact, to reverse and produce the Petri net, so to reverse engineer your tasks, to take what was done and figure out how it was done. This effectively reverses the workflow cycle, which I'll show you in a minute. But one of the big benefits of this is this delta analysis idea. The idea that, if you will, that you get a Petri net out of your workflow mining, and if a Petri net went into your system originally, what you could do is then take those two, superimpose them, and determine what you intended and what you actually got and the differences. That's where things like semantic meaning might come in real handy. Like that's where the real value of these things come in. That you can measure the values against one another once you have those things built on top of your system. Now, as I said, the workflow mining life cycle. Typically you have design, as we saw, someone specifying a guideline, configuration where the ontology is put in, an enactment, which is where it's run, and diagnosis, which is, of course, where your tasks are gathered. Over here is where we want to be doing the work. Typically, people are stuck over here. They're doing design. They're doing configuration. They're taking all of this effort. whereby what I'm suggesting is that really the gain is in going backwards to discover those workflows, those clinical processes which were done. Cook and Wolf proposed ways of doing this. They wanted to use a Markovian approach, mixing algorithmic methods based on finite state machines with statistical methods to deal with noise. These techniques were rather effective, but they had one downfall, and that's that the graphs they used cannot represent cyclic workflows. This leads to lots of problems. The technique proposed, of course, does not support some workflow patterns. As we say, non-free choice is simply a mix of synchronization with a choice. But the one that we're really interested in is arbitrary loops are not really supported in this. So as I said before, you're only limited by your imagination when you build them. Well, in reality, when you have these complex workflows like the kind that you find in hospitals, you really want to be able to specify anything. You don't want to have to put constraints that a simple loop has to be between two tasks. You want to be able to represent anything. So this is a real drawback. People have done this now. They have actually implemented the workflow net discovery, they call it, the workflow mining in healthcare. So they've gotten good results. But again, as they say, in practice, they weren't able to deal with the case of arbitrary loops, even though to other levels of complexity, multiple disciplinary patients, they were able to attain the results using the methods of Cook. So we need to do something to actually capture these loops. Now, as I say, sample computer science problems, well, there's workflow mining itself is not perfect. I've gone over it again and again, the arbitrary loop. We need to overcome this. And I'm also suggesting that possibly a synergy between workflow mining and the systems themselves. They're both two sides of the same coin, but yet they're actually not put together. You do one process separate. I would like to have a system where you can do the delta analysis immediately. At the time that you want it on demand, you can pull out that Petri net that was your result, conduct your analysis, all those things. So I think that's the real value in this in the end. Now, how do you fix this? Well, I'm suggesting a solution whereby a workflow representation based on adapted entity relationship models can be used rather than Petri nets. This entity relationship model is part of my work. It's been conducted with Don Cowan, a professor here at the school. And it supports all workflow patterns. It's based on active databases, the implementation. To show you quickly, to streamline the method itself, what you have the concept of life cycles, which belong to entities. Everything exists in a life cycle. Within that life cycle, you have certain stages which happen within some kind of sequence. And then what you have within them, you have the tasks. So you have the different ordering, the different ways in which these things are run. If you graph this out, what you find is a much different graph from what you expect. You don't see a Petri net thing. What you're looking at, if any of you are familiar with software architectures, this looks like the containment graphs that they use. And in fact, I was able to do a lot of my own analysis using techniques borrowed from architectures. Well, I'll speed ahead by showing you on this map here how an architecture would look. Simply put, an architecture here would be a system with subsystems and within the modules. So there would be a module would be exported. It would be visible from another subsystem. All these sort of things happen in architectures. Well, here we have our formulation of a life cycle. We have stages, and then we have our tasks within. You can use the same type of models, containment models, to represent them. Experience is shown, as I say. We're able to represent them in tuple attribute language and use binary relational algebra to recover all manner of loops. You have things like containments, as I said. Carrying forward, what I've found is that, as I say, you have these representations, binary relational algebras, things like that. I'm able to go right into Prolog and actually map this thing out and have it discover this workflow. So what I can do is solve the arbitrary loop problem. This is a convoluted type loop that you might see. You wouldn't expect to see it, but I can represent any loop in this declarative language. So the mining process simply becomes using Cook and Wolf to recover a workflow net, feeding it into my formalism, discovering the loops, and then modifying your original workflow to represent this. And my reflections are that many analogs exist between workflows and architectures. What you're finding in the end is that it would be great to have your workflow mining embedded into your workflow management system, and that's the goal of my future research. I've had good results to this means so far, and I'm looking forward to actually being able to show someone this soon and say, here's your delta analysis system. Thank you.
Bill, there's been one study I looked at had on the order of 150 commercial workflow representation systems. Some of the major hospital information systems vendor already have workflow engines. How does this affect that? I mean, why do they have so many tools out there, yet there are unsolved problems like this?
Well, I believe that it's that separation. Like when I was talking about synergy between workflow mining and workflow management systems, I believe that in most cases they are not the same system, that people are taking these as two separate things. When I look at it in comparison with architectures, I look at people have a conceptual architecture, which is what they're hoping to do, and then they have a concrete architecture, and typically people don't keep up with that as time goes, so they do these software re-engineering projects whereby they say, my architecture's got out of hand, I'm coming back. Well, in these cases, I think that people, they build their workflow management system, they're happy with it, they run it, everything is great. They don't take into account the workflow mining aspect of it. It's sort of a new branch of the same studies. So this is sort of, maybe I'd say it's not as mature at the moment, the workflow mining itself.